Hi everyone, welcome to the condition presentation about neurocognitive disorder due to a traumatic brain injury. My name is Jennifer Valdez and I will be student A in this presentation, so I'll present an overview of traumatic brain injury according to the DSM-5. A traumatic brain injury is defined as an impact to the brain that is caused by an external physical force that can result in impaired ability of cognitive functioning as well as physical functioning. It really is trauma to your brain. It's also commonly referred to as a TBI. A TBI can happen anywhere and to anyone. In order for a person to meet criteria for a traumatic brain injury within the DSM-5, they need to have one or more of the following: a loss of consciousness, and if so, how long? Did they suffer from amnesia after the event? Do they appear disoriented or confused? And are there neurological signs that a person is suffering from? A traumatic brain injury looks very different to everyone, as it is an injury to the brain. Everyone's brain develops differently and has different wiring. The healing process of this type of injury is not like someone with a broken bone, and care immediately following the traumatic event is critical. Symptoms arise immediately after the impact and can persist past the acute recovery period. Traumatic brain injury is classified as mild, moderate, or severe. You may have heard the term concussion before. A concussion is a mild traumatic brain injury, which results in a brief change in one's mental status or consciousness. A milder traumatic brain injury can typically recover within days to weeks and last no more than 3 months, whereas a severe traumatic brain injury can last for an extended period of time. The severity depends on one's amount of time they were unconscious. A person with a mild traumatic brain injury may have lost consciousness for a few seconds or even a few minutes. A person with a moderate traumatic brain injury would have lost consciousness for anywhere between an hour to 24 hours. And a person with a severe traumatic brain injury would have lost consciousness for more than 24 hours or possibly would have been in a coma. When we think of someone suffering from post-traumatic amnesia, we think of an individual that cannot remember the events that caused the injury, or they can't remember other significant events that have happened in their lives. They may also not remember their name or currently where they are. Other neurological signs are the sudden onset of seizures, a decrease of their senses such as vision or smell, or a brain injury that can be seen via a CAT scan. Characteristics of a traumatic brain injury will vary per individual, and each will display different signs and symptoms. Neurobehavioral changes can be immediately following the injury, and you may see a change in the person's emotional function. Within a person's emotional function, you may see changes to their frustration tolerance. They may have increased irritability, mood instability, increased tension or anxiety. Some personality changes that are common are physical aggression, a lack of desire for the person to do past activities that they once enjoyed, or they may have an increased suspicion of others. Some somatic symptoms one may experience are headaches, fatigue, sensitivity to light, sleep disturbances, dizziness, and reduced tolerance to psychotropic medication. Neurological signs one may develop are seizures, visual disturbances, or orthopedic issues. A person with a traumatic brain injury is at a higher risk of developing co-occurring mental health disorders such as depression or anxiety. In addition, the person is at an elevated risk of developing a neurodegenerative disorder such as Alzheimer's. A person with severe traumatic brain injury will likely have difficulty completing activities of daily living and will require assistance to live independently. This slide is a brief overview of risk factors associated with a traumatic brain injury. Age is an indicator of increased traumatic brain injuries. Although it can happen to anyone, they are most commonly found in children who are under 4 years old or adults that are older than 65. Why, you might ask? Well, these two populations are prone to falls, which is the leading cause of a traumatic brain injury. Motor vehicle accidents are the second most common way of sustaining a traumatic brain injury. Other ways are if one is attempting to self-harm, such as attempting to commit suicide. If someone is assaulted or struck by a person or object, it can also lead to a traumatic brain injury. For example, I have been working with a youth who was pistol whipped, and due to the magnitude and location of the hit, he suffered a traumatic brain injury which decreases overall cognitive functioning. A common cause of milder traumatic brain injuries are through concussions, which happen more often than not with adolescents and young adults through sport-related accidents. Doctors have been discussing collisions and blows to the athlete's head that have led to traumatic brain injuries. Over 1 million people a year within the United States sustain a traumatic brain injury, and 50% of those individuals are males. 2% of the population live on a regular basis with an associated disability of a traumatic brain injury. Recovery from a traumatic brain injury varies based on the assessment at the time of injury, history of the individual, such as prior brain damage, neurological functioning, age, and substance abuse, which can impact the person's ability to recover. My final slide for my portion of the condition presentation is a link to the video that depicts a traumatic brain injury and provides a quick overview as well as highlights the different areas of our brain that could be affected. I apologize in advance for the dry humor within the video, but I think the video gives a whole snapshot of a traumatic brain injury. Thanks for listening.